Well, good afternoon. Thank you so much for choosing this session. It's a really excellent topic, and I'm so thrilled that Reeva, Misra from WONE is here to talk to us about managing stress and why it's so important to invest in this in your organisation. I'm Janet Cooper and I'm the moderator today, and I've been involved in many organisations like chairing the RNLI, in a private company that runs horticultural services up and down the country. And there's nothing more important than looking after people's health and particularly managing stress. So I'm really interested in this session today. So thank you, Reeva. I'm going to hand over to Reeva now. Just to remind you, you've got your Slido open. If there are any questions, put them in there. And obviously, Reeva has obviously got a stand here today on the floor above at 92 for further questions afterwards. But over to you.
Thank you, Joanna. Hello, everyone. It's great to be here today at REBA. And I'm looking forward to talking to you a little more about the cost of stress, so how to better understand the impact that stress is having on your organisation and how to develop targeted interventions that are both personalised and impactful. We'll go through some of our latest research that we've done on the topic, where we've leveraged our data sets that we gather on our platform to fuel discoveries that can then power understanding in the space and allow us to really develop the business case for why investing in stress and well-being is so important, not just for individual health, but also for business health. So I am Reeva. I'm, as Joanna mentioned, the founder and CEO of WONE, and we are a personalised health coach. And our mission, as you can see, is very simple: to reduce stress in 100 million lives. I started WONE about 5 years ago, and actually I would have never imagined that I would end up in this space. I started my career off in a research lab at Oxford, looking at sensory brain development. And I still am fascinated by the study of the brain. I think there's so much that we still don't know about the brain. But I would spend years working in a lab, working on a piece of research, and I would publish it, and I'd just think, so what? And I was frustrated by not seeing the scale and reach of this research in the community. And so that's when I got really interested in the power of technology, and in particular the power of AI, to really create that scale and reach of impact. And so I moved into the field of technology, working in applications of health, AI and technology. And my last role, I was working with a lot of big pharma companies looking more at traditional healthcare. But it really surprised me when I was looking into the research of healthcare that actually the majority of diseases, over 70%, are chronic illnesses. So things like diabetes, hypertension, heart disease, chronic liver disease. And they don't have any cures. The only way to truly address them is prevention. But when I looked at our healthcare system, all our healthcare efforts are focused on when we're sick, so that reactive treatment. And it seemed like a huge unaddressed need to actually target the preventative space and help people address their health before they get to that point of sickness. So start to develop symptoms and targeted solutions earlier on. And when I started digging into the research around prevention, I kept seeing stress crop up in the literature. It was really quite startling, because I personally had always seen stress just as, just something that's like a byproduct of our busy working lives and something we just get on with. I didn't realize that stress is having such a profound physiological impact on our bodies that actually over time is building up and leading to chronic illness. So I started digging into the research around stress, and it was quite startling, actually. It was, stress. I'll give you a little bit of a download on the science of stress. So stress is actually the good news. It's not all bad. Stress is an evolutionary response that we've developed as humans to actually prepare us in times of danger and threat. It's called the fight or flight response, which some of you might be familiar with. But essentially, when we're stressed, our nervous system changes. It goes into what's called the sympathetic nervous state. And our body is preparing for that fight. So if it's brief and momentary, like, for example, preparing for a talk like this one or a big presentation, it's good for you because it gives you the increased focus. It sharpens your memory, sharpens your energy, and it prepares you for that important moment. The time when stress is bad is when it's persistent, and that's when it becomes chronic. And in the lives we're living today, that's where, unfortunately, we're seeing these extremely high, dangerous rates of stress because our bodies are constantly in this heightened sympathetic nervous state, and we're never able to recover. And so in this graph, I've just given an illustration here on the left of someone in the dotted line who is in a constant state of stress. And as you can see, their stress is constantly peaking, and they don't ever go back into recovery mode, which is called the parasympathetic nervous state. And that's when our body, because it doesn't get time to recover, is not able to carry out normal body functions like memory consolidation or immune system functioning. And that's when it can build up and lead to chronic illness. And so whilst the problem of stress is quite large and biologically complex, actually, when we were looking at solutions to stress, what was quite surprising is that the solution doesn't need to be. And it really centers around these short micro moments of recovery. And I think what's really fascinating to me is that actually 90 seconds is all it takes to move from a heightened stress state that's called the sympathetic state, as I mentioned, into that recovery state, the parasympathetic. And so brain imaging studies and physiological studies have shown that 90 seconds of breathing can move you into that recovery state pretty much instantly. And so the bottom line of the graph is an employee that has done these short 90-second, 2-minute micro moments in their day. And you can see their stress curve actually turns into a healthy one where they experience peaks of stress, but they also experience the recovery. And so I think this just illustrates actually how important it is to bring about those short moments of recovery in the working day. And it doesn't need to be hours of practice. So, whenever someone tells me, I'm too busy to prioritize my health, I don't have the time, my reply is actually, you must have 2 minutes in your day, and all it takes is just a quick micro moment. I actually just wanted us to try a micro moment today because this talk is after lunch when we're typically in our afternoon slump. And I know you've probably just been overloaded with information all day, and I'm about to go into more data and overload you with more research. So I thought we could practice a quick micro moment together so that we can see it in action. So if you all do this with me, if you get into just a comfortable position, place both your feet on the ground. And when you feel ready, you can allow your eyes to close or you can gaze downwards. And start to observe your breath. So start to notice your inhale and your exhale. Notice breathing through your nose, the air going in through your nose, and as you breathe out, the air leaving your body and your nose. And use this awareness of your breath to really focus inward and release any external thoughts. If any external thoughts do come, just observe them and bring your awareness back to your breath to refocus. And we're going to take 3 deep breaths together. I'm going to count us in, so exhale, and we'll start. Inhale, 2, 3, 4. Exhale, 2, 3, 4. Inhale, 2, 3, 4. Exhale, 2, 3, 4. Inhale, 2, 3, 4. Exhale, 2, 3, 4. And then slowly return back to your normal breath, keeping your eyes closed. And just observe any changes that you might feel or experience since the beginning of the practice or when you walked into the room. And when you're ready, you can open your eyes. Great, so I hope that will just give you a very quick, that was literally 3 breaths example of how introducing these micro moments can, very quickly move us into our recovery mode and give us a quick reset in the day. So this is a very simple technique that you can use in your working days, or I would encourage at conferences like this. It's when it's most important. And now that we have done that short micro moment, we're going to go into the research and the data. So we conducted this study that looked at the link between stress that employees are facing in an organisation and the knock-on impact that's having on business risks and costs. And the reason we did this research is because, we really strongly believe that employee well-being and managing employee stress should be given the same business imperative and the same time at board level than any other business matter, right? The same way that we measure financial risks, operational risks, reputational risks. There's no reason why we shouldn't be measuring our people risks in the same kind of rigorous analytical way. And I think this is so critical to just get we all know that kind of employee well-being and stress is something that's important, but to get the case built at leadership level and board level, I think we need to talk in the same language with the same kind of numbers and metrics. And so we ran this study with 1,000 employees across the UK and US, and we surveyed the employees with our WONE index, which is our scientific gold standard measure of employee stress and resilience. And then we also surveyed employees across 17 different measures of risk, things like absenteeism, health claims, critical mistakes, intent to leave, etc. And we found, we looked at the data, so we looked at employees in stress states and correlated that to business risk. And I think just at the high level, the main stat we found around stress is that 86% of workers reported experiencing some kind of stress, and 45% of the whole sample reported experiencing severe levels of stress, so saying they were always stressed or highly stressed, which is extremely high and goes to show the scale of the problem, but also correlates with other research from the World Health Organization, McKinsey, etc. And what we found with the results was honestly the highest correlation between stress and risks than we could have ever imagined. Our chief science officer said in her decades of research, she's never actually seen such a high correlation in results before. And you can see actually in the graph on the right, you can see the 2 graphs that we looked at. Those are the 5 different states of stress. So on the left side, it's employees reporting no stress. And then on the right side, it's employees reporting always being stressed. And you can see that as employees go from no stress to always stressed, sick leave is the top one. So sick leave rises. So it goes from 0 to 11 number of days of sick leave per year. And the same with health claims. So we go from 1 to 7. And so you can see we found the same across mistakes made, hostile relationships at work, intent to leave. And we looked at the cost this is having on an organisation. And we didn't do the calculations for health claims, but everything else. So sick days, presenteeism, absenteeism, etc., is costing 12K per employee, so per high-stressed employee per year. So that's the savings that we can reach if we are able to better help those employees move from high stress to low stress states. So yeah, I think this research just builds a really conclusive case for why investing in employee stress and well-being is not just a public health concern, but also actually really important for businesses who want to lower their costs and mitigate business risk. And I think for me, why this really matters and why it's so important is because stress is something that we all know personally is a really important, really important thing for us to control. I think through my time of researching stress, it's been actually quite shocking, the personal stories that I've heard. So, I've had CEOs of Fortune 500 companies come to me saying, the day they left work was when they suddenly experienced severe chronic illnesses. I've heard stories of someone who had to go into a brain surgery the day they left their job, and stage 4 cancer, and so just really devastating illnesses. And I think it's something that we all have our own personal stories for. It's ironic, I'm running a company focused on preventing stress, but I also experience huge amounts of stress in what I do. So it's something that I think we can all relate to, no matter the scale or depth of the issue. But I think what's now powerful is that we actually have the tools to take action and bring about change to create safer, healthier workplaces for our people. So off the back of this research, we developed a scientific theory called the Stress-Risk Thermometer. And this thermometer is a way for organisations to be able to apply this method into your businesses and into how you're looking at people stress and business risk. And so there are essentially 3 steps to this thermometer. The first step is segmenting employees into high, medium and low stress zones. So similar to, as I mentioned in our research, how we assessed employee stress. So that's the first step. And that can be through surveys, pulse surveys, existing platforms, or new surveys that you might collect. The second step is then looking at the business metrics that are important for you to measure on people decisions that you're making. So whether it is things like absences, turnover, retention, etc. It's that we find that tends to be quite personalised depending on the organisation. So if you're seeing certain business metrics around your people that you do want to better understand, it's identifying what those business metrics are. And then the third step is really correlating those together. So looking at the stress states of the organisation and correlating that to certain business metrics to be able to detect patterns in what you're seeing. So, for example, you might see that a certain geography is experiencing much higher stress than another one, and they also are seeing much higher turnover. So you can start to segment different populations based on geographies or maybe departments, job type, seniority level, and start to see really interesting findings that will then allow you to use that data to create a more comprehensive, targeted health and wellbeing strategy that's very personalised to the particular gaps or needs that you're seeing in the organisation. I do think it's important just to offer a quick note on data privacy here, because data privacy, with the increase in technology and AI being used in all areas of our life, I think data privacy becomes a really important thing for us to be aware of. So we always say that it's really important to communicate back to employees how the data is being used. So make it very clear that only ever, for us, we say only ever anonymized aggregated data is shared back to your employer. And we also urge employers whenever, if you're doing any kind of surveys or collecting any health data, just to be very clear about what the data is being used for and that no individual data is ever being collected. I also think with these findings, it's really important to make sure that they stay on the aggregate department or geography levels. And so it's more used to find positive strategies versus individual blame. Those are just two important call-outs on the data side. And at WONE, we actually, based on the research that we did and the findings, we have now launched a new product that helps companies just on the data and insights piece. So we do now help companies actually create their own dashboard and insights report to better understand the health of the organization and find strategic interventions that are proactive and personalized based on the data and based on measurable outcomes. And we do already work with various clients globally in various different sectors to, as you can see, build these kind of dashboards that allow us then to find very specific proactive strategies. And off the back of that, we see just much higher engagement. So our engagement rates in our platform are about 8x traditional EAPs or benefit providers. And we've also seen over 70% of people using the platform actually report an improvement in their stress. So their stress scores go down and their resilience goes up from using the platform as well. And finally, if you do want to learn more about the research, these are just QR codes. So the left one's for our white paper, the right one's for a Harvard Business Review study that was published just last week, actually, 2 weeks ago. And they go more into the scientific theories and the methodology as well. And as mentioned, we have a stand upstairs. So if you do want a hard copy of the research, we do have hard copies upstairs as well. But yeah, thank you very much for listening. I hope this provided a little bit of a crash course on the science of stress and measurement systems for measuring the impact of stress and business risk in your organization. And if anything, I hope you take the micro moments as a way to just quickly reset in between a busy, stressful day.
Thank you very much. And I think we've just got time for one or two remarks here or comments, but I've just got a quick question here for you. Yes. When you go into a business to support them, what do they appoint you to go in and do?
So we call ourselves your personalised health coach. So I haven't spoken that much, which thank you for asking, about our platform, because what we do is we provide each individual employee with their own personalised health programme. So we provide each employee with their health score. And then using the score, we apply AI to create a personalised health plan of different kinds of interventions based on your score. So that's what each individual gets, their personalised health plan. And then on the employee level, we provide the data and the insights about the company's overall health score and targeted interventions as well.
That's really helpful. And presumably, when you go into a company, you can either be appointed to look after the workforce or 5%, if they identify people that might need your specific support. It's not all or nothing. It's presumably a range of choices.
Well, given the stats on stress, given it is something that impacts 85% of the workforce, we tend to say, if not everyone, if someone tells you and they're not stressed at work, I actually don't think I've ever heard anyone say that to me before. So it tends to be, I think you see other kinds of treatments like therapy or fertility or menopause tend to focus on certain populations, whereas stress is pretty universal.
Yes. Having been a partner in a city law firm, I could agree with that. It is everywhere. Any quick questions for Reeva? One at the back there.
Yeah, I just wondered whether you've got any examples of collectively owning. So what I find is, as individuals might take on these self-regulation tools, but we also know that environmentally, the organisation can pile a lot of pressure on people. this is what I get a lot. So, you know, it's the old, you know, like manager in would say, well, you come to my team to speak about resiliency. You know, the first one, what's going on in your team, the change, you know, time pressures, how you people to do their job. Do you have any examples where this data has then, you know, sort of been a catalyst for a change at an organisational level as well?
Yeah, definitely. I think that's why we're not just an app that can sit on, you know, a long list of benefits and is up to the individual. It's why we work so closely with the organisations to provide organisations with the same platform, but on the organisational level, because we really strongly believe this is both an individual and an organisational responsibility. So we do both. And I think what's really interesting is we work with a lot of firms or companies where they typically do have highly stressful environments, like long working hours, like law firms, finance firms, you know, big tech, corporate environments. And what we found is that finding leadership champions has been really powerful. So we find leadership stakeholders that really believe in our platform. We might bring a speaker in, like an A-list TED speaker, to do a talk with one of those leadership stakeholders. And that's where we really see the cultural impact happening. So after those talks, we've had leadership members who've then gone and bought the books of the speakers, given it out to the team, started speaking to their team about lessons that they've learned. And then we've got testimonials saying they feel like they're a better manager, they're less reactive, they're more considered in their approach. So we find that going in at leadership level has definitely been the fastest way to create cultural change.
Thank you very much. Now, I think we're out of time now, but stand 92 upstairs. If you've got any further questions, I know you'll be really pleased to answer them, and really inspired by your session today. So thank you very much for joining us.